Nigeria in 2017 alone recorded an unprecedented outbreak of meningitis, reportedly recording the highest burden rate of NEISSERIA MENINGITIDIS SERO Group C. With prompt action on the side of the government and interventions from global partners, Nigeria overcame the epidemic. Now, new cases of the strain C meningitis were, however, diagnosed in Niger State earlier in the year, reportedly killing 4 persons. What is the situation with meningitis in Nigeria? How much of vaccination has been done? And can we say Nigeria has totally overcome the other types of meningitis? And why does it appear that the C type is ravaging? Answers shortly from experts. I am Joy Usiago, and this is Nigeria Today. With me in the studio to look at the topic is Dr. Emmanuel Wilson Chidema from the National Primary Health Care Development Agency, Abuja, on my far left. I want to thank you for joining us.
Thank you for having me on the program.
Also in the studio is Dr. Tena Nomwange, who is the Accelerated Disease Control Focal Point Person of the World Health Organization Country Office in Nigeria. Thanks for joining us.
Thank you for having me.
Gentlemen, we thank you all for coming into the studio to talk about this important topic at this time. Let me start with you, Dr. Nomwange. Cerebral spinal meningitis. The layman may ask, what is that?
Thanks, Joy. Cerebrospinal meningitis or meningitis basically for everyone, or what I always say for my grandmother to understand what we're saying, basically is just an inflammation of basically the brain or its covering. So basically, in very simple terms, this is what meningitis is, and like you will know, this inflammation is usually caused by some infection, be they bacteria, be they viruses and things like that. But commonly, any inflammation of this covering will basically result in some kind of meningitis or meningitic symptoms.
All right, Dr. Chidema, what are the symptoms for children and adults? Are they different or are they the same?
Well, just like you said, the symptoms depends on the age affected. And for children below the age of 1, their symptoms differs from the symptoms of older children, maybe children above the age of 1, and adults. For children below the age of 1, they usually feel sick, they have fever, they become so irritable, they refuse to feed. When the mother gives them food, they withdraw from the food, which is unusual. They also have swelling of the anterior fontanelle. Fontanelle here is, there's an opening in the head of a child, and it's supposed to be a depression. But when he is infected with NEISSERIA MENINGITIDIS, it tends to bulge out. So there's bulging of the anterior fontanelle. You could also have a rash that looks like a bruise on the body. This rash, a normal rash, if you press it, if you apply pressure, it fades off. But in this instance, it remains. In some instances, just to know whether just to differentiate from a normal bruise, you use the glass test. You may just take a transparent cup of glass, press against the bruise, and if it fades away, then you are not dealing with an infection with a meningitis. But if it remains, you look for a nearest hospital and consult a doctor. But for adults and children above the age of 1, their symptoms vary. They also feel sick, they have fever, they complain of headache. Unusually they don't, when they are sitting here now with this bright light, they feel uncomfortable to bright light, which is unusual. They also have the rash, just like I described in the children. They may have stiffness of the neck. The neck becomes stiff, and even some other parts of the body may also be stiff. So if you see this, you look for the nearest health facility and consult the health personnel to see whether you could do something about it. Because if you identify the disease early, you could save a life.
Now, Dr. Nomuhange, listening to Dr. Chidema talk about these symptoms sounds complex. I mean, and they also sound similar to some other diseases. For the ordinary person, for whoever has these symptoms to nip it in the bud at the very early stages, what are the things that they should look out for immediately, since the symptoms sound quite similar to some other diseases?
Okay, thanks. So just following up on what Dr. Chidema has talked about, again, we said this is an infection. So for every infection, whether it's be meningitis, it be malaria, it be anything, usually you will have some similar symptoms. So from a fever, which like you said is one of the key things that comes up, then you have the headaches, and then you have all these meningitic symptoms. What is important, I think, is not waiting to say, oh, I want to sit down and I'm sure that it's meningitis. What we're encouraging people to do, for very simple terms, is that once you have a fever, a high-grade fever, and you have any of the meningitic signs, if you have there's a seizure, or you have any meningitism where you're not able to turn your neck, like we've said, or sometimes you just notice that that person is just not really aware of himself. He's lost a bit, some impairment of consciousness. What we're encouraging most people out there to do is to go to the facility and have it checked. Now, the health workers in these facilities usually have been trained to be able to detect or differentiate these various things that we're talking about. The main way to make a diagnosis of meningitis, the gold standard basically will be to look at this person with this set of symptoms, and what we usually will do is do what is called a lumbar puncture, where you stick in a needle at the back, and you have the cerebral fluid. Basically, this is the fluid that covers the brain and the spine. And this fluid comes out. The first thing you will notice is, does this fluid come out with a jet of pressure? That jet of pressure shows that, okay, you have that inflammation and you have what is called increased intracranial pressure. You also look at the color of this fluid. The fluid is supposed to usually be clear. So in most cases, you will have, in the meningitic cases that we're talking about, you now have a cloudy cerebrospinal fluid that comes out, and you can clearly see just from the appearance. But mainstay is to have this fluid, which we're talking about, actually tested for the kind of organism. And this testing is really critical, because this testing tells us the various kinds of meningitis that we're talking about. I heard you talk about whether we're doing a C type, it can be an A type, it can be a W, it can be, you know, so you have those various types. And sometimes it might not even be bacterial. It might be some other type, that is fungal, or a virus that is causing this. So that testing is really critical for us to actually make that diagnosis and confirm that this actually is meningitis that we're dealing with.
All right, Dr. Chidema, Nigeria falls within the region referred to as the meningitis belt in sub-Saharan Africa. What is the burden rate in Nigeria?
Well, cerebrospinal meningitis, it's relatively rare. Rare in the sense that it affects maybe 1 in 4 adults, and maybe younger children. But the problem is that once infected with the disease, the consequences may be grievous. Grievous is the sense that the consequences that comes with the infection are so serious. That's why we said that any of the symptoms that you got the meningitic symptoms with the fever, you go for a facility so that you could get assistance from a qualified professional. The consequences could be, it could lead to blindness, it could lead to deafness, somebody could have impairment of some functions that the brain controls. The person could have, it could even lead to death. So for us not to have these consequences, it's good that anybody that begin to have these symptoms, most especially during epidemics that happens along the meningitic belt of the sub-Saharan Africa, which constitutes of about 19 states and the FCT in Nigeria. Once there is an epidemic, there is an outbreak of the disease, if you have fever and any of the symptoms we've mentioned earlier, most especially bulging anterior fontanelle in a child, and the rashes, or in an older child and an adult, when they begin to have some stiffness around the neck and he has fever and he's feeling unwell, it's good for him to go to a facility so that he could get some assistance.
All right, Dr. Nomuhanga, Nigeria had to deal with the strain C type last year, which we are told claim up to about 500 lives. Now, at this moment, can we say Nigeria is in a safe place?
I think we've made a lot of progress, but again, there's still a lot of room for improvement. And like you know, we dealt fairly well with the previous outbreak that we had, and in the recent epidemiological weeks as well, we've also been seeing an increase in the C-type meningitis. We also need to go back a bit and also realize that we had a nationwide campaign with the Men A-type. So what you will notice happen is that in the last 2 or so years ago, where we had actually vaccinated persons aged 1 to 29 years, almost 70% of the population, we had vaccinated them against the Men A-type. So what you saw happen is that once we were able to deal very nicely with the Men A-type, you now had an increase in the occurrence of incidences of the C-type. So we don't have these antigens as part of our routine vaccination or immunization system, so we have to keep responding to the type that comes up. So in the last year or so, we've had these responses to the C type, and we've been able to deal with that. So currently as well, we're also having a couple of LGAs in a couple of states that have surpassed what we call epidemic or alert thresholds. So we have these numbers which we use to determine whether we are in an epidemic.
So are we in a safe place, or we're on the way to the safe place?
I think we're moving forward. I think we're making progress. I think we've had working with government and most of the system that allows for reporting, because it's easy for us to say, oh, the numbers are small, when in actual fact maybe we are not reporting. So there's been a lot of sensitization, a lot of training of health workers. So people are actually reporting every single thing. So they're not waiting up to say, oh, maybe this is a spiritual thing, or maybe, oh, you know, that kind of thing. So people are well sensitized now. So for every single thing they see, they are reporting. So I think we're making progress in terms of that. And of course, the government has made lots of progress in terms of reacting. So instead of waiting to hear that, oh, people, these numbers have died and all that, once we're working with our epidemiological data, we're seeing places where we're seeing an increase in numbers compared to a previous time or so.
All right, let's take a short break. We'll be back. You're watching Nigeria Today, coming to you from NTA News 24, and we have been looking at cerebrospinal meningitis in Nigeria, the causes and effects. We'll take a break now to find out about citizens' knowledge on the disease. When we return, we will be looking at it from the preventive and curative perspective. Don't go away.
Do you know about cerebrospinal meningitis?
Yeah, I know about it. I know about it as a transmission disease. Yeah.
Okay, well, transmission disease in what sense? As in, can be transferred?
You can transfer it through having contact with your next neighbor. Yeah.
Have you ever vaccinated against it?
Yes, before coming to camp. I have to take the vaccination before coming to camp.
Well, what I know about it is a sickness that when it attacks you, your head, the front of your head will turn back, while the back will be at the front. It's a disease that is so destructive.
Have you been vaccinated against it?
Yes, with God.
Have you ever taken vaccination?
Yes. Yes.
The hospital?
I say the blood of Jesus is the one that is doing my own.
Well, maybe the time I was small, I don't know. Maybe my parents did that for me, but for me, I've not done that.
Never. I've never. Except if they vaccinated me when I was young. I don't know of now.
Welcome back and thanks for staying with us. Gentlemen, I want you to react to the short video clip we saw there. Let's start with you, Dr. Chidama. What's your take on the reaction from the streets?
It's actually interesting to note that despite investment into the prevention of cerebrospinal meningitis in Nigeria, many people out there do not even know how to get the disease or what to do to prevent the disease. So that's why I say it's actually interesting.
Dr. Nomhonge, let's hear your reaction.
Yeah, so for me, this is, I like the first response that says, oh, it's a communicable disease and all of that. When you also hear someone that says, oh, he brings spirituality or religion into it, this is also something that is not just about meningitis, it's also about health-seeking behavior generally. You know, that tendency for people to feel that, oh, we from a religious point of view, we're healed. But for me, all of this is not bad. The main thing is that this is a disease that is preventable. We know how this disease is transmitted. We have a really effective tool in terms of the vaccine, which can actually prevent spread. And most importantly, we also have the clinical expertise and the knowledge. We have a management protocol to prevent, even for people that get infected, to prevent sequelae, like Dr. Chidama talked about, all the complications that come out of it. So in terms of this, we will keep, it's always about information, is always about health promotion and letting people know how all of these things happen. But it's interesting you've shared this. And I think from the government point of view and for the key players in the field of not just meningitis, just the health generally, people know that we need to keep engaging. We can't just engage one-off.
Well, we'll come to the issue of engagement much later. Let's talk about, you talk about the preventive measures. Let's talk about that aspect. Dr. Chidama, is this disease curable?
Yes. You see, cerebrospinal meningitis is both preventable and curable. The nick is that cerebrospinal meningitis quite differs from other infectious diseases in the sense that cerebrospinal meningitis, the age group of affectation is wide, unlike other diseases that are contracted from contacts. And again, it has many strains. And these strains, one vaccine cannot take care of all the different strains. But it's very important to note that it's preventable. The vaccines are very potent.
And are the vaccines available?
Yes, vaccines are available in the sense that, just like I told you earlier, the vaccines are variable. The different strains that the cerebrospinal meningitis has, that's how the vaccines are produced. And before now, Men A used to be the strain that is in outbreaks, that's implicated in outbreaks. But for 3 successive outbreaks, MENC came up. Just like he stated earlier, there was a mass campaign for MEN-A, and because MEN-A is going down, MENC now came up, and we've been having unprecedented outbreak, just like you mentioned earlier.
Of C.
Of C.
And why is this so?
It is so because our attention was on MEN-A. We had mass campaigns for MEN-A, and we begin to see upsurge of the MEN-C, the serotype C. Now we give reactive vaccination to outbreaks that come up, but the MEN-A is the one that we use for mass campaigns. Just like he said earlier, like in 2017, we vaccinated about over 70% of the target population, and it's a common knowledge that if a particular strain is attacked at that rate, other strains could come up, and that's why we're having the MEN-C type.
All right, let me come back to you, Dr. Nomhange. I guess you want to add a bit to what he said.
Yes, because he had made that point that we have different strains of these antigen, and it's not as if I get vaccinated against type A, I'm protected against C and all of that. So I'm protected against the strain from which I have. And so you've also had some vaccines in the market that are not just targeting a particular strain, but you now have what we call maybe a bivalent, which is maybe a combination of 2 or 3, or a tetravalent or things like that. But basically the point is that we had vaccinated people against type A. We had immunity for type A, but because the immunity doesn't cross-react with another thing, those strains, remember that this antigen basically this infection is passing, basically it's airborne. So you have at the back of our throats or our mouth, you have, in some people are just healthy carriers. They have these organisms at the back of their throat, but they don't have any problem. So they might have the various strains in there, but don't have anything. But in these times, you're able to, during the dry season, lots of wind and all of that, lots of coughing, lots of overcrowding, you now have all of the increased spread, and you could have anything if you're not protected against that.
Okay, that takes me to the issue of information dissemination and advocacy. You did make reference to the video we just watched a while ago, that it is obvious that some people are not well informed, and there's need for advocacy. What should we be doing in terms of advocacy, quickly?
Well, for me, this is everybody's business. It's not just about health workers, it's everybody. Starting from within the community, from the traditional leaders and all of that, from the religious leaders as well. You know, then also, of course, from a health worker point of view, everybody must know that this is a disease that is caused by infection, and this is a disease that is spread from basically strains or droplets. And we also have this vaccine which will protect you, and even in the event where you come down with the disease, the chances are that once you get to a hospital and you get treated, the chances are that within 4 to 5 days or so you will be well.
All right, quickly to Dr. Chidema. Now let's hear your take on the issue of advocacy and passing information across to the people, not just in the urban areas but even in the rural areas.
Yes, you see, it's very important to give to the public the control measures for the cerebrospinal meningitis, because that one goes a long way in curbing the menace of the disease. For instance, there are 3 control measures for controlling meningitis all over the world, and in Nigeria inclusive. The primary prevention he mentioned earlier, where we disseminate information through gatekeepers, through caregivers, through health workers, through ourselves that are living here, and teach the population on how to prevent themselves from contracting the disease. We said earlier that it's an airborne disease, so personal hygiene is very important, and the populace have to know how to observe personal hygiene. Just common hand washing, cough hygiene. When somebody is coughing, maybe he covers his mouth. When he's sneezing, he covers the mouth. When somebody excretions from the throat, you know how to manage it properly so that it will not get to another person.
All right.
You also have, if you identify the disease early, you
it can be treated.
Yes, you could also go to a health worker who will give you the appropriate antibiotic to treat the disease. That's why I said earlier that it's both preventable and treatable.
All right, gentlemen, we've run out of time. I want to thank you very much for coming into our studios. This is quite informative, and we do appreciate your time. That's it on this edition of Nigeria Today. I want to thank you very much for your time, and do have a great weekend. I am Joy Oseago.